Hi there, I'm Dr. Michael Hyman, and I wanted to address a question that I often receive, especially from men, but women too, whenever I tell my patients or advise my patients to return for a test called cystoscopy. I've discussed more details about cystoscopy on another video, but I really just wanted to address the question that people will say, do I really need a cystoscopy? And I want to explain to you why it's such an important test, and it's really fundamentally, for every urologist, the absolute important thing to do when we want to understand anything from why you're having urinary conditions, frequent urination, slow stream, prostate conditions. Some guys, for instance, will be on medication. They may say, hey, I'm already on some medicine for my prostate condition. I'm urinating a little better, but that's the operating word. They're not really optimal. And what we need to know is, are we even treating the right thing? Because some of those drugs are really symptom management drugs. They're making you think things are better because maybe your stream is a little better, maybe you're getting up once or twice less a night. But make no mistake, there is still much to understand. They're not really addressing the underlying problem in almost every case. Again, if it's a prostate condition, there's a medicine called Flomax that a lot of men take, and they may see some symptom improvement, but again, their bladder may be still working extra hard to go through this tight pathway due to their prostate condition. And cystoscopy is going to answer that question of what is really causing this blockage? What is really restricting my flow? Is it really my prostate? And what you have to understand is that in our business, it's not something we can image. A lot of people say, well, why don't you just get an MRI or a CAT scan? It's similar to why we do colonoscopies. I don't do colonoscopies, but a gastroenterologist does a colonoscopy because a CAT scan or an MRI cannot see inside these hollow structures. So like your colon is basically a hollow structure. The CAT scan is very poor at looking inside that. So you have to put a camera in there. Same with the urethra and same with the bladder. We have to put a camera in there to really see. And much like if you were to have a knee operation or a hip operation from your orthopedic doctor, where they would get an MRI to get the details before they do a procedure, for example, or to just understand what's going on with that pain in your knee or that ache in your hip, they'll get as sophisticated of an imaging test as they can, and that would be like an MRI. In our field, the most sophisticated imaging we can get is a cystoscopy, which is looking inside the urethra and the bladder with a little camera. And again, to go into further detail on that, you can look at some of my other videos on cystoscopy.